Hey everybody, in this episode of the Quick Hits podcast, we're joined by a very special guest, Ganesh Persad, Director of IT Applications at Memorial Health System, who also happens to be the president of South Florida HIMSS. Ganesh walks us through his unexpected journey into healthcare IT, a journey that began over 15 years ago. Diving deep into his experiences over the better part of the last 2 decades, his passion and determination are evident. Ganesh comments on the ever-evolving role of AI in healthcare, the integration of clinical systems, and the profound impact of healthcare IT on patient care and patient experience. We also explore the challenges of interoperability, the increasing role of AI in healthcare, and the significant need for clinical insights at the point of care. Ganesh shares a touching personal story that highlights the potentially transformative power of IT and patient experience. Throughout this episode of Quick Hits, Ganesh emphasizes to Ken and me transparency and leadership, the importance of understanding the why behind projects, and the responsibilities that come with being a technology leader in healthcare. And just a reminder to follow @HealthDataMovers on LinkedIn for more content around unleashing the potential of healthcare data and technology.
Welcome to another episode of Quick Hits. I'm your host, Ken Booth, joined as always by my co-host, Tyler Smith. Tyler, how are you this week?
Ken, I'm doing very well.
Excellent. Well, ladies and gentlemen, we are joined. We have a special guest, or a great guest this week. We're joined by Ganesh Persad from Memorial Health System. Ganesh, please tell us a little bit about yourself.
Hey, good morning, everyone. So my name is Ganesh Persad. I've been in the healthcare space for over 15 years. I currently work at Memorial Healthcare System as the Director of IT Applications and Digital. What does that mean? I oversee our consumer facing applications, so MyChart, and really having a focus on digital and innovation around consumerism, patient experience, amongst other things.
Wow, excellent. How did you get to become the director of clinical systems?
Yeah, it's been quite a journey. I never thought I would be in healthcare. I actually wanted to be in media arts and TV production coming out of high school. And I had a friend that worked at Walgreens with me, and he was in pharmacy school and he was graduating. So his spot was opening up in the pharmacy, and he was like, "Hey, I think you should come in here." And it was my junior year of high school, and I was like, and I did it for the reasons because I was like, I'm going to make more money, right? So typical teenager.
Absolutely.
And that was my first entry into the healthcare space, and then I kind of chalk it up to having really good leaders and really good mentors that's helped shape and guide me through there. So after I took the job at Walgreens, I graduated high school. I ended up moving to Orlando because I was able to get a job as a pharmacy tech at a hospital in Orlando. And that was my first experience into the healthcare IT space. A couple of years after that, this little thing called Epic came around. And then once the enterprise went live, the organization started to focus on rolling out Epic to the ambulatory areas. And that's when the opportunity came knocking for me. Was, I had a great opportunity. I had a lot of folks that believed that I had what it took to be in that role. And I was given a chance to come into IT by our CIO at the time, Shafiq Rob. The first implementation was our cancer center, helped co-lead that. But again, it wasn't myself doing it. It was an entire team. It was a lot of consulting resources that was able to help. And then fast forward after that, I ended up coming to sunny Florida in 2015, got promoted to a supervisor, overseeing interoperability, so anything HIE interface related. Then manager over our Connect program, and then now here as the director overseeing, MyChart, interoperability, our Connect program, consumerism.
I will ask, so you mentioned kind of learning. So you learned Epic, and then you had to learn how to build relationships. What insight can you provide on building those relationships? What did you learn most?
I think being yourself, right? Don't try to be something that you're not. Be honest, be open, do the right thing, stay humble. I think those are all things, and I think just taking that extra step, whether it be a provider, whether it be a medical assistant, whomever you're interacting with, and it requires you to get to know them both professionally, and I think take it a step further to get to know them personally as well. I think a combination of all of that helps for a very fruitful relationship.
Let's talk about HIMSS membership a little bit. You would encourage that for anyone involved in healthcare IT, or is it really only if you're looking to basically achieve your level of success?
No. So one of the things, so I became the president of our South Florida chapter in June. And, traditionally, like you mentioned, HIMSS has had this distinction around just IT, right? IT professionals. And one of the goals and the visions for my, I say tenure, so the next, that's a year and a half now, is to evolve that into more of, yes, keeping the IT focus, but bringing in the clinicians, bringing in the providers, bringing in the nurses, bringing in the pharmacists, because they touch technology every single day. And I think they touch technology more than you and I, right? And I want them to have a seat at the table. And I'm proud to say, like, our board has 4 physicians on it. And we're starting to look at partnering with additional local chapters around nursing informatics and stuff like that. So I want to broaden it, right, and start bringing the others that touch technology within the healthcare space to the table and provide programs and content around that as well.
Yeah, that's a great idea. I mean, for all the innovation that IT wants to make, you won't be successful without clinicians. Mm-hmm. So that's a great idea. So how do you approach then the challenge of integrating with clinical information systems and kind of ensuring interoperability? Because things are just, they're pretty complex. And I have to imagine that Memorial Health System is extremely complex.
Yeah, I mean, I think, so twofolds. When we first started this journey, it was around the HIEs evolving, right? So the care qualities of the world, the e-health exchanges of the world. And I think the legislation, the ONC has helped progress us to a point where we're, I would say, stable from an HIE perspective. And then we're going to continue to evolve and build upon the standards that TEFCA and all the QHINs and stuff are gonna oversee. And I'll give an example. One of the applications that I oversee is our telephony system, TalkDesk. And it may sound simple, right? That when a patient calls, we set up a virtual agent and they're able to cancel, confirm, reschedule, get directions for an appointment. The value proposition in doing something like that as an organization is that those calls that are going to be addressed by the AI, the virtual agent, is one less call that a live human is going to have to take. So you can translate that into cost savings, you can translate that into efficiency, etc. So things like that, it's really taking the time to understand how is that integration going to enhance current state.
Is there any concern about losing that human touch as you're making some of these decisions? There is. And I think, when healthcare is in this journey for digital, right? We're looking at revolutionizing the healthcare space to catch up with the, Ritz-Carltons of the world, the Deltas, the Amexes, that right. type of experience. And they've been doing it for quite obviously longer than us. So that experience, consumers are accustomed to that. What are some other trends, like kind of emerging trends in AI that you have your eye on, or, if there's anything you can share, like where Memorial Healthcare Systems is kind of looking to utilize AI even more, maybe in a clinical setting, or right now are you mainly just focused on information systems and interacting with patients as far as scheduling, et cetera?
We're doing a lot on, I would say, more on the finance side, like around robotic processing, automation. We're evaluating utilizing AI to help provider efficiencies. So like Nuance's DAX system, leveraging the Gen AI within in baskets, and then additionally, looking at others that are out there to help align with our digital experiences as well. So, whether it be a conversational AI, I think it's early on, but it's like the gold rush, right? Because there's so many solutions out there that say they could do the same thing, but again, it goes back to taking a pause and making sure that whatever it is that we're looking at implementing, that it's going to impact our clinicians, our processes for the better.
I kind of wanted to ask about a moment in your career. Maybe this is kind of like a personal story where you realized the true impact that healthcare IT could have on patient care.
Yeah, I'll share a personal one. So when my daughter was born, she was in the NICU for about a week and a half, 2 weeks. And, as parents out there, it's one of the hardest things, right, is to see your child or any child in that situation. And one of the solutions, and I was in IT at the time, I wasn't intimately involved in this particular project, but I was aware of it, where they created, we homemade, homegrown the cameras where family members can see their child. And
oh wow,
when I now as a patient parent had to utilize that, like that was impactful, right? Seeing a simple solution, right, that had that type of an impact where I couldn't physically be there, but I was still able to be there and interact with the clinicians. One of the other ones, our Connect program. We rolled out Epic to a physician who was on paper, believe it or not. The very first patient that they saw was a patient of Memorial's. They were seeing an oncology provider. The provider that we rolled out Epic to was a PCP. And that same patient was also seen at another Community Connect provider site. Right off the bat, the patient said, she's like, this has probably been one of the most easiest appointments that I've had. You had all my information. You weren't calling and requesting faxes. Because I guess the experience from that patient prior to us going live was that they would come into the office, they would have to wait until the front desk called and requested information was faxed, and it caused a delay, right, in care. And she was like, what changed? I'm like, we implemented Epic. And that was one of the things, and I was like, that's the reason why we do Connect, right? The clinical integration, the interoperability, and having that continuity of care,
right,
is what makes the difference. And I'm sure I have a lot more. If something comes up, I'll...
Hey, Ganesh, I love these stories, and I think going back to what Ken was talking about, your journey to becoming a leader, how as a leader do you communicate these stories to the individuals you work with and inspire them on a day-to-day basis?
Yeah, I always try to explain the why. Whether it's a solution that was implemented before and folks are questioning it, or anytime there's a net new project and that we're working on, again, whether it's a process improvement related project or a technology related implementation, really explaining the why, explaining whether it's a strategic priority, whether it's going to improve clinical care, It's going to have cost savings. I really try to be as transparent as possible, because I think what I've seen, and I appreciate when my leaders are transparent in the sense of, okay, well, I just don't tell me to do this project, right? Just taking the time to understand, why is it that we're doing it? What's the benefit? Because there might be things that I get right away. There might be things that I probably just need some more information. And I try to convey that same messaging to my leaders and my direct reports, because once they understand that, then when they go in to facilitate conversations, they have that foundation to build upon, so that we're all working towards that one common goal. And that could be any type of project that we're working on.
So now it's kind of time to brag about yourself a little bit. 2018, you received the Chancellor's Award for Biomedical Informatics. Tell us a little bit about that award, and what do you think led to achieving that award?
So that was
award?
When I was doing my master's at Nova Southeastern University in biomedical informatics. And I think it was just, being in the profession, so understanding the health IT space, it kind of lent itself into the academic side of things, right? So not just being a student, but also being a resource to others that are trying to get into the space, and even with the professors and stuff like that. And I think I gained their trust and respect around what's going on. I still talk to all of my professors today. They want me to come and become an adjunct, but I'm still waiting on pulling the trigger on that. But the Chancellor's Award was, and again, it was quite a surprise. It was one of those things. I was invited to a graduation dinner. No idea. I had no idea I was getting it. So I was very, very surprised, and I was honored to be recognized. I'm reading it right now. Like, I'm looking at my wall, and it says, for demonstrating the characteristics of scholarship, leadership, integrity, humanity, and loyalty for the profession. And I think I try to do that throughout, whether it's at Memorial, whether it's outside in the community, to always uphold what we do in healthcare IT, what we do in healthcare, and not give it a bad name. Because there's a lot of talent, there's a lot of time and resources that put in effort into making healthcare IT what it is today. So it's almost like a cult. You don't want to tarnish the reputation that you have for the integrity of the profession.
Wow. So you feel a level of responsibility. That's great. What's next on the horizon?
The notion of AI being used more widely, but being used to drive change, drive clinical insights at the point of care that our clinicians didn't have easy access to before that. I see AI being used more on the big data landscape, right? So taking all this data now that we have in the EHR, over the last, say, 15, 20 years, right? We've compiled so much information. And I think, we've always talked about big data, right? And I think now we're really starting to see the impact that that's going to have in patient care. I think you're going to start seeing more genomics related labs, being incorporated into care. I also think that we're going to see a growth in virtual and telehealth more so than it is now. I know the pandemic, everyone knows this, right? Like, the pandemic catapulted the use of telehealth, but now I think you're going to start seeing telehealth be a vehicle for helping with the access issues that we have, more so for those specialties and subspecialties that may not have fully adopted it yet, but starting to see that being used a lot more. Not just, again, the direct to consumer telehealth, but virtual within the hospital. One of the things that we're working on now is virtual patient observation. So instead of having a one-to-one sitter in a room, you can have a virtual sitter that's watching, 8 to 12 patients, right?
Okay.
So you're going to see cost savings and efficiencies there.
Right.
You're going to start seeing the nursing workforce start to shift. Obviously, you still need physical nurses, but you're going to start seeing a mix of virtual nursing that can help with, let's say, your initial intake type questions, right? When you come in to the hospital or the ED, or if you're getting ready to get discharged, those coordination, pre-planning type exercises, activities that go on where it doesn't necessarily require a physical person to do that. Starting to see that evolution start to unfold. And then even further, going back to the AI topic, looking at layering in AI into that virtual patient observation, that virtual sitter, where, if a patient is at risk for falls, right, and they start to get up or their gait is off, that sounds an alarm, right, without a human having to do that. So right. I'm excited. I mean, I think the possibilities are endless. I think we just need to make sure that whatever it is that we're looking at rolling out, that it's, safe, that we're not putting anyone at risk by doing that, and really taking the time to design those processes and those workflow efficiencies around safety and patient experience and
right.
stuff.
No, that makes a lot of sense. It's great to be optimistic, but also realistic on what the current state of AI is and just how important those clinical decisions would be. So I really like the idea of that, the virtual nursing, just even observing multiple patients at a time, it really would free up the workforce. Well, Ganesh, this has been a great conversation. I really appreciate your insights and just your journey in general, and even your approach to being a leader and a mentor. I really appreciate your insight there. Tyler, any final questions or final thoughts?
Very grateful for your time, Ganesh. And it's always nice to talk about Memorial, since that was actually my first Epic project.
Oh.
Yeah. But, most importantly, right now is hurricane season. And today there are actually waves at Rockaway. But I was more excited about having a conversation with you than getting out into the 3 to 5 foot swell that we've got going on up here in New York. And I know you are a big fan of Rockaway as well. So
yeah,
it's good to be
I love
talking with you
Rockaway.
today.
Is this going to be our promo photo for the episode? Do we have like some Ganesh surfing?
Oh, you don't want that,
Ganesh
my friend.
And Tyler surfing videos?
You don't want Ganesh surfing.
I think we've got a good photo of Ganesh wearing some HTM swag in Hawaii. So maybe we can use that.
Oh, perfect.